Much of the discussion about the U.S. healthcare system relates to what happens within the walls of hospitals, clinics, physician offices, and long term care facilities. Professor Mattachoni will spend most of his time discussing the service delivery system. However, we know that much of what actually happens determines the health of individuals and the population as a whole happens outside of the service delivery system. In this chapter, we will be discussing population health and how it intersects with the healthcare system. One of our first challenges in examining population health is to sort out how the population health model is different from the medical model and what these ideas have to do with health and healthcare. I will examine how these two models might lead us in different directions as we engage in improving health. We will start a discussion on the determinants of health that we will study in more detail in Chapter 7. I'm going to challenge you in this discussion about population health to think about how looking at health and healthcare through this lens can lead us to new and innovative strategies to improve the health of the population. An important tool in population health is data that provides evidence about social, physical, and environmental impact on health behaviors and outcomes. Population health asks the question about why there is variation in health and life expectancy. Why does where you live impact how long you will live? Health is a complex issue without single answers, so we will have to look at more complex approaches to clinical and population health problems. Maybe we should start at the beginning. What is population health anyway? Kindig and Stoddard in 2003 published an article in the American Journal of Public Health proposing a definition of population health. That definition is the health outcomes of a group of individuals, including the distribution of such outcomes within the group. Population health studies the causes of health discrepancies by looking at the health data and the patterns in that data among different groups. This data can help us identify factors that lead to poor health outcomes. The determinants of health are varied and complex. In order to study determinants of health, we have to use models that incorporate these factors that affect health outcomes. The model of population health on page 81 of your text is based on this model, which is similar to the social ecological model we will discuss in Chapter 7. This model considers the effects of individual traits such as age, sex, race, biology, and genetics, social and community networks, living and working conditions, and the broad social, economic, cultural, health, and environmental conditions and policies at the global, national, state, and local levels. The text describes 5 domains of health determinants that impact health as a result of exposure to these determinants and also how they interact with one another. Sometimes described as the web of causation, because healthcare outcomes can affect the determinants of health. One example is that poor health, such as having a chronic disease, can impact your income. So, what characterizes the medical model? Your text describes the model as one that focuses on individuals, specifically factors that are immediately related to the pathophysiology underlying a person's disease. The traditional medical model has been described as one that views the physician as responsible for diagnosing the illness, deciding on an appropriate treatment, and assuring that that treatment is carried out as prescribed. The example we most often think of is that of an acutely ill patient who is hospitalized. The physician diagnoses the disease, decides if the patient should be admitted to the hospital, and guides the subsequent care. This is part of the traditional role of the physician. The patient trusts the physician and puts their care in the hands of the physician, accepting the care the physician prescribes. The physician decides what laboratory tests will be performed, how the results will be interpreted, and what the patient will eat, and whether nutrition is relevant to the treatment plan, what type and amount of medication will be given and when it will be given, whether surgery or other invasive treatment is needed, and when the patient is well enough to leave the hospital. This model is reactive in the sense that it is focused on addressing that person's disease. This chart compares the medical model and the population health model. As you can see, the medical model focuses on the individual and factors specifically related to the pathophysiology underlying a person's disease, as we mentioned before. The individual with obesity is assessed by the medical provider for their individual risk factors and behaviors that contribute to their obesity and a plan of care that may include a referral to a nutritionist, diet, and exercise as prescribed. The population model focuses on the population, in this case, those individuals who are obese, and looks at the cultural and environmental factors that contribute to obesity. The population health model considers multiple factors that contribute to obesity, such as availability and affordability of healthy foods and knowledge of healthy foods, and how to eat a healthy diet. Multiple factors in the community contribute to the problem of obesity. Interventions that address these factors can be effective in reducing obesity in the population. Tobacco use is another public health problem that has both a medical and population health model approach. At the individual level, the focus is primarily those who use tobacco products and supporting them to change their behavior. The population approach looks at the factors that influence tobacco use, such as advertising and availability of tobacco products, especially to youth. The interventions in population health to change behavior are at a population level and include policies such as smoke-free restaurants and businesses, tobacco taxes, and social marketing that targets high-risk groups such as children and teens. The social determinants of health model demonstrates how social determinants influence health behaviors and outcomes. Two of the social determinants of health that are most predictive of life expectancy are income and degree of education. College graduates can expect to live at least 5 years longer than those who did not complete high school. Upper and middle income Americans can expect to live more than 6 years longer than poor Americans. The County Health Rankings model was developed at the University of Wisconsin Population Health Institute to help communities understand the factors that influence the health of communities and how long they will live. Not all communities are the same in terms of their health behaviors, their access to clinical care, social and economic factors such as education, employment, and income, and the physical environment, such as availability of affordable housing. Note that clinical care contributes 20% to health outcomes, while social and economic factors contribute 40% and health behaviors 30%. We will explore these factors more in chapters 7 and 8. The county health rankings reveal a major issue related to what is spent on healthcare, what contributes 20% to health outcomes as compared to what is spent on prevention. We spend 2/3 of all healthcare expenditures treating preventable diseases, but only 5% actually trying to prevent these diseases. A key problem we can wrestle with is how to change this inversion of expenditure and spend more on prevention and less on direct medical care. Your text describes many evidence-based strategies to fund prevention and develop policies that support prevention. Population health data contributes to demonstrating the cost effectiveness of prevention. Population health is a framework that is being used by healthcare organizations to use the determinants of health to reduce healthcare costs. The Institute for Healthcare Improvement introduced the concept of population health as part of the Triple Aim initiative. The 3 goals of this initiative are improve the health of the population, enhance the experience and outcomes of the patient, and reduce the per capita cost of care for the benefit of communities. Population health is most commonly used to describe the management of a specific population in the healthcare system. You may have heard of the frequent flyers or frequent visitors to the emergency department and the interventions that try to prevent their frequent emergency department use. In general, population health is broader than the healthcare system and is used to look at populations in the community and the factors that influence their health.